Hello everyone. Today in this video I am going to cover the competency number 7.8 and 9. So in competency 7.8 it is mentioned that we have to educate the mothers on the antenatal breast care and prepare the mother for the lactation. So how will you do it? Basically we should understand what is the difference between breastfeeding education and the breastfeeding support. Mother require both. So in the breastfeeding education during the antenatal period, either we can educate the group of the pregnant women or and their partners, or at individual level also we have to educate the mother about the breastfeeding. And breastfeeding education can also be given by the peer group, and we can conduct some educational program. Some didactic teaching sessions can also be conducted and workshop, and we can distribute the booklets also to educate the mother. In breastfeeding support, in the postnatal period after the delivery to the mother, all kinds of support, psychological support, physical support and financial support should be given by the family members and the healthcare staff. In breastfeeding education, we should provide the complete information and we should demonstrate the breastfeeding technique, because breastfeeding is a skill that mothers learn. So always we have to explain them and also demonstrate them what is the good position for the baby and for herself, what is the good attachment, and for demonstration we can use the dolls or mannequin which is available in our institute. We should explain the mother that what are the benefits of the breastfeeding to baby, mother and family. As the breastfeeding is the best food source in the first 6 months of the life for the baby, it improves both child and mother health. Also, mother-infant bonding improves by the breastfeeding. Lower chances of various infections and allergic disorder, better visual acuity, speech and the cognitive development of the baby. There will be 4 times more risk of osteoporosis in the women who are not giving the breastfeed to their baby. Also, there are chances of various cancer in the mother if not giving the breastfeeding. So, we have to explain each and every aspect of the breastfeeding. Now, in the competency number 7.9, we have to educate and counsel for the best practices in the breastfeeding. So to prepare the mother for the lactation and for effective breastfeeding, these three things are required. First is willing and motivated mother should be there, and the motivator should also be there. So all health professional who can bring both mother and newborn together, so should motivate the mother. An active and sucking healthy full-term baby is also required for the effective breastfeeding. Example, if the baby is preterm sick, then obviously baby cannot take the breastfeeding. So what are the best practices in the breastfeeding? We should have the written breastfeeding policies in our department and in our institute where the mother and baby cares are taking place. Motivate the mother from the antenatal period. When the mother is pregnant and coming for the antenatal visit, motivation for the breastfeeding should be started right from antenatal period. And after the delivery, breastfeeding within 30 minutes of the birth in normal delivery by the breast crawl should be done. And in LSCAs as early as possible within 4 hours. Promote the rooming in of the mother and the baby, and also bedding in. Mother and baby should be in one bed. Promote the breastfeeding, frequent breastfeeding, either demand feeding or every 2 hourly feeding we have to promote. We have to tell the mother that in best practices should not give any prelactal feeds, means any feed which is given before starting the breastfeeding considered as a prelactal feed should not be given. Do not use the bottle to feed the baby. We have to support the mother in breastfeeding. We have to explain the mother in initial few days till the establishment of the breastfeeding occur. Treat the breastfeeding problems early. Even during the antenatal period, if the mother is having retracted, inverted nipple should be corrected. and tell the mother that exclusive breastfeeding till 6 months. After that, breastfeeding plus complementary diet should be started. What are the causes of not enough milk and how will you correct it? So in causes, whenever mother is not giving the frequent breastfeeding, then prolactin reflex will be suppressed. Whenever mother is giving the too short or hurried breastfeeding, for the sufficient breastfeeding, mother should continue the breastfeeding at least for the 20 minutes. Then only baby will get the both fore and hind milk, and also prolactin reflex will be stimulated. And night feeds should not be stopped early because during night time when mother is giving the more frequent feeding, prolactin reflex will be more stimulated and milk secretion will be more if mother is giving the night feeds. Poor sucking position and the attachment will also lead to this, and poor oxytocin reflex. If mother is not happy, having anxiety, stress, lack of confidence, then oxytocin reflex will be suppressed. Any breast problem, engorgement, mastitis, abscess will lead to the not enough milk. Now, how to manage the not enough milk? We have to tell the mother, put the baby to breast frequently, every 2 hourly or demand feeding, and give the breastfeeding with the good attachment and proper position. We should tell the mother that mother should be happy, confident, then only milk will be secreted more. And also we should explain to the family member that they should support the mother, they should take care about the emotional health of the mother also. If required, after doing all these things, we can prescribe the galactogogue also. In this, generally we prefer the metoclopramide, and also if not corrected, then we can give the uh, Satavari powder, which also contain the some galactogogues, which will increase the secretion of the milk. So thank you so much. This is all about the education and the counseling of the mother about the breastfeeding.